Don't know about the secret core muscle? Welcome to Muscle Monday, and today we're going to talk about a muscle that serves as a core muscle, although it is typically forgotten about when you talk about core. Today we're going to talk about the diaphragm. The diaphragm is a dome-shaped muscle that cuts your abdomen in half, separates your thoracic cavity, which is your heart and lungs and your chest, from your abdominal cavity, which is all your other organs that sit down in your belly. The diaphragm's primary function is breathing. So it's dome-shaped to cut you in half right here. When you take a breath in, it will flatten out, which then decreases the pressure in your thoracic cavity. That allows your lungs to fill with air. And then when you breathe out, that domes back up, increasing the pressure in your thoracic cavity, forcing those lungs to push air out. Secondary function, or another function of the diaphragm, is actually to serve as a core muscle. So when the diaphragm flattens out, what it's doing is it's decreasing the pressure in your thoracic cavity, but it's increasing your intra-abdominal pressure. So that pressure that's inside your abdominal cavity, it's increasing that. It works in conjunction with the transverse abdominis, your pelvic floor, multifidus, and some other deep back muscles to form a cylinder with your core, and it's the top. I tell people think of your diaphragm as the top of a pop can. So if you pop that pop can open, or if your diaphragm doesn't engage, then you lose all that pressure that you had stored in that pop can. So you have to learn how to properly engage your diaphragm so that you can get intra-abdominal pressure. Clinically, this is what I address most with the diaphragm, is working on getting that re-engaging and turned back on so that you can have proper intra-abdominal pressure, so that you can support that low back and lumbar spine through movements, so that you don't get unwanted movement, damage, extra pressure on the joints and disc. It's a really important thing for that. That's gonna do it for our Muscle Monday. Join in on Thursday. We're gonna do Treatment Thursday and talk about how do we do proper diaphragmatic breathing to engage that so that we can increase that abdominal pressure, as well as a couple kind of fun facts about it. So see you Thursday.